Flitner,
Here.
Ottman,
Here.
Martinez, Stivar,
Present.
Wharf excused, Wilson excused, Mr. Vice Chairman.
Here,
Mr. Vice Chairman, we have 5 present.
5. Okay, that's a quorum.
We don't need. It's just, yeah, and there's, there's the thing too with the hospitals. Oh, good. And then the prices would be set. And they couldn't charge more.
You think of the former administration that was going to do away with the family care. They tried to, but then they didn't. It's working for them. You think about Trump was going to do away with it.
I'd turn all these mics off.
But he didn't because he heard from people through.
Yeah, I'll have to look because I read
Utilize
that
that.
about
Yeah.
before, and then I thought.
Can you hear us?
Yes, I can, Mr. Chairman.
Thank you. That allows us to proceed with Senator Steinmetz. Going to present her bill.
Thank you,
House
Mr.
Bill
Chairman.
or Senate File 34.
Thank you, Mr. Chairman. And we'll just start over. So thank you for committee for hearing Senate File 34, Born Alive Infant Means of Care this morning and taking your time to do that. While we may have spirited debates on the floor about when life begins and how pregnancy affects both the rights of the mother and the child, it is my hope we can all agree that once a child is born alive, all rights apply equally under the law. We have seen evidence this last year in Wyoming that we will go to extreme measures to save just one human life. This has been exemplified in the measures taken to fight COVID-19. Today, I'm asking you to consider Senate File 34, which seeks to refine language currently in statute in order to clarify the means of medical care for an infant who survives an abortion and is born alive. As many of you will remember, this bill is an old friend. Last year, the legislature overwhelmingly passed in both houses the Born Alive Infant Means of Care Act. I would contend the bill is even more important in 2021. I'll take you through the bill now. It's a short bill and a short read. All we're doing in 35-6-104 on page 1 is stating the commonly accepted means of care that would be rendered to any other infant born alive shall be employed in the treatment of any viable infant aborted alive. Any physician performing an abortion shall take medically appropriate and reasonable steps to preserve the life and health of an infant born alive. And while we're speaking of viability on page 2, line 1, I'd like to read the definition of viability to you just so that you have that in your mind as debate begins. And in 35-6-101, under section A, VII, viability means that stage of human development when the embryo or fetus is able to live by natural or life-supportive systems outside the womb of the mother according to appropriate medical judgment. So that gives you kind of a basis of what we're doing here with the bill. In closing, I would leave you with this thought from our Wyoming Constitution, Article 1, Section 2, equality of all. In their inherent right to life, liberty, and the pursuit of happiness, all members of the human race are equal. And that concludes my comments. I would stand for any questions and defer my time to those wishing to testify today.
Thank you, Senator Steinmetz. Is there anybody on the committee have questions for her? Seeing none.
Thank
You
you.
might
Mr.
want to stay here for a while to see how we dispose of this bill, but
I will stay. Thank
Beyond
you,
that.
Mr. Chairman.
thank you. How many in the audience wish to testify? 1, 2, 3, 4. All right. Do we have any Anybody, Bonnie, that's from the administration or an agency that wishes to speak first?
Mr. Chairman, I don't see anyone from the state agencies on the Zoom.
Okay. With that in mind, I guess we can proceed with the audience here, and would you come forward? State your name and who you represent.
Mr. Chairman, Committee, Brett Moline, Wyoming Farm Bureau Federation, sitting in support of this bill. This bill fits in with my members' policy that determines the position that we take on any legislation. We're either for or against, but we are for this bill for the sanctity of life. With that, Mr. Chairman, I'll try to be brief because I know you'll have a lot of other comments. So with that, Mr. Chairman, I would sit for any questions.
Any questions? None.
Thank you.
Thank you. Representative Jennings, would you like to come forward and give your comments?
Thank you, Mr. Chairman and committee. Glad to be here this morning and rise in strong support of this. This can be characterized, people have in the past attempted to put it back towards abortion type thing, but this is a child that has survived that. And this is a most vulnerable of the most vulnerable. And so if we can't protect those people, I fear for our society. And so I rise in very strong support of this. Think of that little baby. And we need to give you as Mr. Chairman, as a doctor, you would not contemplate not giving care. And so I rise in strong support of this. Stand for any questions.
Thank you, Representative Jennings. Anybody have questions for Representative Jennings? Question? No? Thank you.
Thank you,
And
Mr. Chairman.
appreciate it.
Thank you, Mr. Chairman, members of the committee. I'm Mike Lehman, and I'm representing the Catholic Diocese of Cheyenne. We support this bill, and I would just say perhaps the best question I heard last year on the floor debate on this bill was, is this really a problem in Wyoming? Or is this a solution looking for a problem? And that's a great question. The answer is we don't really know. We know that this could be happening. We heard an anecdotal story in the other chamber on their floor debate about it happening decades ago in Wyoming, but we don't really know. It is possible because of the mother's health exception allowed for in Doe versus Bolton was very broadly defined. And so it's possible for a viable baby to survive an abortion in Wyoming. But the truth is we don't know what we don't know in Wyoming. Providers have resisted every single bill that sought to shed some light on the situation. We hear a lot of things reported as if they're fact. There are only 2 providers in the state, right? I mean, I'm sure you've all heard that. But is that just the surgical providers? Or are we talking about medical abortion providers as well? Does that include the 2 who, until this year, were not reporting abortions performed in their facilities like Wyoming law has required for decades? Or are there others? 2 years ago, this body passed a fine for providers who were discovered to not be reporting. And the reports have started coming in. But the reality is there's not much oversight at all in Wyoming. And we feel good whenever we pass a pro-life bill, and we should. And I don't want to downplay the importance of this legislation. At least it provides the possibility for retrospective action. But the truth is we don't know what's happening in Wyoming because we haven't really wanted to know. Mr. Chairman, members of the committee, we stand in support of this legislation, and I would stand for any questions.
Any questions for the witness? No. We have one question from
Actually, it's just a
Representative
comment.
Ottman.
Thank you, Mr.
Proceed.
Chairman. Actually, it's a comment. I want to thank you for your testimony because it just brings up the point that this isn't the end of it, that there needs to be further information gained and things to be done. So thank you very much.
Thank you.
Thank you.
Thank you.
Mr. Chairman, Bill Winnie, Sublette County. I spent 30 years active duty in the Navy, to include some 5.5 to 6 years as a commanding officer, where I had perhaps a limited amount of supervision responsibility for medical, particularly on my submarine, where we had only a independent duty corpsman. And when you're 1,000 miles at sea, he's all you got. They're very good. Having said that, the point I'd like to make to the committee is military medicine, particularly combat medicine, has a number of cases where people were declared dead only to be later found alive in some extraordinary circumstances. And I believe as we talk about an infant that was delivered by whatever mechanism that is alive, we're obligated to sustain that life. And I find the fact that somehow as we deal with this in the legislative process or the legal process, and even have to ask the question of whether we would sustain that life or not, tells me that somehow, somewhere, we've hardened our hearts. Subject to your questions, thank you very much, Mr. Chairman.
Thank you. Any questions? Don't see any. Representative Nyman, please come forward. State your name and who you represent.
My name is Chip Nyman, Representative House District 1. Thank you very much, Mr. Chairman. Committee, I want to reiterate everything that everybody's been saying. My district and the folks I represent are in full support of this legislation. It is just ironic to me that we would even have to pass legislation like this to try to preserve a human life. And I appreciate the opportunity to be able to be a co-sponsor on this legislation. I thank the bringer for having the resourcefulness and the willingness to stand by the truth of this matter and to bring it again after last year's effort. And I just fully support this legislation, and the folks I represent do as well. And so I just want to make sure you all folks know that. So thank you for your time.
Thank you, Representative Nyman. Any questions for Representative Nyman? Don't see any. With that, I guess we can go to the internet for their.
Mr. Chairman, I have 5 individuals in the Zoom waiting room with their hand up. Shall I admit the first 2?
Yes, please admit that person. Those people.
Mr. Chairman, I've admitted Marty Halverson.
Thank you. And who is that other individual? Go ahead, Marty. Former Representative Halverson.
Thank you, Mr. Vice Chairman and committee members. Good morning. I am Marty Halverson, and this morning I am representing Wyoming Right to Life. Naturally, Wyoming Right to Life strongly supports this bill, just as we did last year. The terms born alive or live birth means the complete expulsion or extraction from his or her mother, regardless of the state of gestational development, of a baby who shows any evidence of life, including breathing, a heartbeat, umbilical cord pulsation, or definite movement of voluntary muscles. This bill will provide babies born alive during an attempted abortion to be treated as legal persons under the laws and the Constitution of the state of Wyoming and receive medically appropriate treatment. The purpose of an abortion is to terminate a pregnancy. Once the mother has been delivered of her baby through an abortion, the pregnancy is indeed terminated. This bill does nothing to infringe upon a woman's right to terminate her pregnancy. This bill does assert the state's interest in protecting an infant whose live birth has occurred as a result of an abortion. If the attempted abortion results in the delivery of a live baby, it is nothing less than heinous infanticide to allow that baby to die. That boy or girl deserves the same medical attention as a boy or girl delivered of a mother who wanted her baby. And make no mistake, every baby is a wanted baby by someone. Please do not be persuaded that a heartbeat is merely flickering fetal tissue, or that breathing is nothing more than breathing motions, or that which has been born alive is mere heartbeating human being deserving of the same medical care. I've lost my Zoom. As any other human being, regardless of age or stage of life. If some consider the medical attempts to save this life extraordinary, I would ask, what extraordinary life-saving medical intervention would you forego for yourself or a loved one? Wyoming Right to Life and our thousands of Wyoming members and friends urge your aye vote on Senate File 34.
Thank you, former Representative Halverson. And any questions for Representative Halverson? Representative Ramirez.
Just a question, Ms. Halverson. In terms of the numbers that we don't know, what do we know and what is it that we don't know that we're maybe an inquiry about or maybe an inquiry about regarding this happening in Wyoming? And I do think there is a lot of information that it is happening in Wyoming. I don't want to get into that, but I just wanted to, as a state leader with your organization, what do you know that you can share with us as we move forward?
Mr. Chairman, thank you, Representative Romero Martinez. As said by earlier testifiers, we don't know. But here's what we do know. We know the atrocities that were committed in Philadelphia by Dr. Gosnell. And anyone who makes the assumption that it only happened then and it only happened there, I think is risking a serious error. This may be happening in Wyoming. We just don't know. But what we do not want to happen in Wyoming is what happened in Philadelphia that was so newsworthy several years ago.
You have any follow-up? No, thank you. Any other questions? Well, thank you, former
Thank you, committee.
Representative Halverson. And our next witness could not.
Chairman.
Thank you.
Mr. Chairman, I've admitted Dr. Renee Hinkle.
Thank you. Please give your testimony.
Thank you, Mr. Chairman and committee. I appreciate you allowing me to testify. My name is Renee Hinkle. I am an OBGYN physician here in Cheyenne, Wyoming. I've been here for 22 years and have been in practice for that period of time and still active practice currently. I don't do abortions. I don't do elective abortions. And so this is not about that in any way, shape, or form. I do believe, as I am sure all of you do, as our Wyoming Constitution states, that every adult citizen has the right to her own healthcare decisions, and the state shall act to preserve these rights from undue government infringement. I will never be able to change anyone's mind as regarding pro-life or pro-choice. That is not the discussion at this moment. I am testifying against this bill because it will infringe on the right of women and families to make their own medical decisions regarding their health care. As you know, Governor Gordon vetoed this same bill last year. It has been changed slightly, which is why it was re-brought up. But he vetoed it not because he's not pro-life, he is pro-life, but because he was able to see the complications that this bill could cause outside of elective abortions done at Viability. Elective abortions are not allowed at Viability, or really after the second trimester are not done in the state of Wyoming, but they're against the law in the state of Wyoming. And so this bill really does not do anything past that. If a child is born that has signs of life, that has the ability to continue life, for sure, medical care is given to that baby. Physicians have taken oath from the very beginning of their career to first do no harm. And if a baby is born at an age where they can show signs of life, then everything will be done for that child. And so this bill really does not have a reason. It does put physicians at risk, however, for when, as you, I'm sure, know, that when we do a delivery in the second trimester, especially if it's before the state of viability, which is changing, I admit. It used to be 24 weeks. Now it's somewhere in the 23-week range. And most neonatal physicians believe that viability really has to do a lot with size as well as with gestational age. And so viability has changed over time. And we do, in many cases, if parents want resuscitation done, even if we as physicians believe the ability for that child to survive is low, we will continue to do resuscitation. That is a parent's, that is a woman's right, that is a parent's right to make that decision for us to do resuscitation. Most deliveries done in the state of Wyoming where this could possibly cause a problem is when we do deliveries on babies that have medical complications that by all expert knowledge is not compatible with life, or if it's the mother's own health that is at risk. If the mother could possibly die by continuing the pregnancy, or if the baby absolutely has, according to expert knowledge, no ability to survive outside of the womb, those are when these types of deliveries are done. If we were to have to do a resuscitation on those infants, it will be only to increase the trauma to the mother and the father, trauma to the infant, trauma to all of the providing physicians, nurses, hospital staff, because we know that the baby is not able to survive because that's why this is being done. They either have massive heart abnormalities that cannot be repaired, they have severe genetic abnormalities that would not allow them to progress in life once they are no longer attached to the placenta. And so this is where those problems occur. And if we have to do resuscitation on any of those infants, it will take away the mother's right, the father's right to make their own medical decisions. And that is a right based on the Wyoming Constitution. It will also increase trauma to physicians. We have a hard enough time getting physicians to come into the state of Wyoming. We have a hard enough time keeping physicians in the state of Wyoming. And for the legislature to make laws to try to govern how we take care of our patients when we have multiple different agencies that are already watching what we as physicians do is just one more step in the process of doing our job more difficult. Several of the people who have testified regarding this bill have talked about reasonable medicine, have talked about appropriate medical judgment. We have to be able to make appropriate medical judgment. And if we continue to legislate and make laws by people who are not physicians, by people who are not experts in this field, we will make it much more difficult for physicians to make medical judgments. And we will be thinking legal judgments and not medical judgments, which are much more appropriate in this situation. As far as Ms. Halverson's information regarding this being done, if something is going to happen like in Philadelphia, it's not going to be happening at hospitals. It's not going to be happening somewhere where a fetus could be resuscitated. So this is a bill that I believe does not have any need in the state of Wyoming. It's already illegal to do abortions after viability. Physicians we will always do what the patients desire, what the parents desire. If a baby is born unelectively and they want everything done, we will do that. We just had one this past week. A patient came in 22 weeks and 2 days, ruptured and in labor. We did everything in the world to try and keep that baby from delivering. And we were able, because of the size of this infant, to ship the patient to Denver, and the patient's still pregnant. She's 23 weeks pregnant now. And that's a win. We do everything we can in patients who have viable infants who have, when something happens. If that baby had been born, we would have done everything in our power in Cheyenne to take care of that infant. So this is not a bill that needs to be done, and it will cause problems in the future for physicians, OBGYN physicians, pediatric physicians, and it is already difficult enough in a state like this to keep good physicians. This is just one more barrier. So I urge you to vote no on this bill, not because you're not pro-life, not because you don't believe in the sanctity of human life, but because you believe in the rights of parents who are adult Wyoming citizens to make their own medical decisions as per our Constitution. So I urge you to vote no.
Thank you, Dr. Hinkle. Is there anybody on the committee that has questions? And Representative Romero Martinez.
Thank you, Mr. Chair. I just have a comment. I just want to reiterate, I think maybe we reiterate too much sometimes, but that heinous infanticide is not health care. And I am working on an initiative to bring good physicians here to the state who are practicing NAMPRO technology. And I just wanted to just make an additional comment that everything one can do is not the best we can do. And if that threat is even for just one, and that's why my name's on this bill, I support this bill. Thank you, Mr. Chairman.
Anybody else have questions? I have a question for Dr. Hinkle. The issue, I believe, is in regard to those babies that are right at the borderline of so-called viability. Is, in your opinion, is a 20-week gestational age infant worthy of the efforts to preserve their life?
Thank you, Mr. Chairman. I think the way you asked the question is just slightly prejudicial, because worthy is not the importance when we talk about medicine. Of course, every life is worthy. And again, we do everything in our power. Truly, we do everything in our power to try and preserve every pregnancy as best we can when that pregnancy has the ability to progress and to become viable and where the fetus can survive. If a 20-week fetus, if a true 20-week fetus is born, and we look now not only at the age of gestation, but at the size of the infant. So under 500 grams and under 22 weeks, by all experts, is still considered less than 5% chance of survival. And when we talk about survival, we just mean they can survive for a period of time. We're not talking about a normal person who can grow up into adulthood. Basically at 20 weeks, 0% chance that that child could survive past a few days.
Thank you. And Representative Ottman has a question for you.
Yes, thank you, Mr. Chairman and Dr. Hinkle. What I have to say is I appreciate your commitment to all of this, but going along with the law that was put into place and finding that we are getting more people to be reporting, I believe this bill goes along with those that are not following the laws that are already put into place and making a firmer stand about that. Whether your opinion of how you run your office, can you guarantee that these things are not being done in the rest of the state? And I propose to you that this is to help that. And as far with what we've learned about abortion is a termination of a pregnancy. Therefore, that commitment by that doctor, I believe, is done as far as the parents go. I mean, they got the procedure they wanted. So we are talking about the next step. Is there any evidence to the contrary? Thank you.
Thank you, Mr. Chairman, Representative. These procedures that you are talking about as far as elective abortions of viable infants are not being done in any medical facility in the state of Wyoming. As I stated, if these are being done, they're being done somewhere outside of normal medical care. And so the ability of any of those people to do any kind of resuscitation is basically zero. This would be done somebody's home. This would be done in a non-medical facility. Any licensed facility in the state of Wyoming, I can tell you 100% these procedures are not being done. And so that number one question, I can't remember what the rest of your question was.
Well, thank you. Just to follow up,
Go
Mr.
ahead.
Chairman, what we heard that there are these procedures going on and that people are now starting to report. So there are some things going on. And while clinics have a certain designation and they have certain criteria to be called a clinic or an abortion clinic, there are other places that don't require all that we are finding that do perform some of these. So while you may speak for your experience, I'm not so sure that you can speak for every community. Thank you.
Thank you, Mr. Chairman, Representative. The abortions that are being done, the elective abortions, I think that's one of the things that this bill brings up. And this is one of the reasons Governor Gordon did veto this bill last year, is because the term abortion is used medically much differently than you in the legislature use abortion. When we as physicians use abortion, it has many different reasons. Yes, it is technically the termination of a pregnancy, but a pregnancy in obstetric communities is not always viable. I mean, we do abortions every day on non-viable pregnancies. Miscarriages is what we call them, but they, in technical terms, are non-viable pregnancies, usually in the first trimester, early second trimester. But when a baby dies or if a pregnancy does not progress to even having a fetus, if it just has placental tissue, we still call that an abortion. And I think that's where some of those terminology changes. And that's why having the legislature make rules that will affect our practice of medicine in other ways. That's why it's so important for us as OBGYNs to stand up against that legislation of medical care. Number one. Number two, the only abortions being done in the state of Wyoming, and we know this through reports, we know this through anecdotal evidence of just talking to other physicians, are first trimester elective abortions. Those are the only elective abortions being done. And over 90% of them, I think even 95% of them, are being done with medication induced and not surgical abortions. These are abortions done before 12 weeks of pregnancy, most commonly before 10 weeks of pregnancy, especially when you talk about medications. So when I say that these procedures are not being done, I mean late term, quote unquote, viable pregnancy elective abortions are not being done in the state of Wyoming.
Any further questions for Dr. Hinkle? Yes, Representative Romero Martinez.
I forgot to add this into my last comment. I wanted to draw your attention to page 2 of the bill. And I just wanted to gently push back in relation to why the governor did not sign it. I think that information might not be accurate. The reason why I think it might not be accurate in your presentation is because I've had an open dialogue with the office of the governor through my short period here, but I've been intensely studying this topic pretty much my entire life because of the values taught to me by my mother and my father. And when I asked the governor, why did he not sign it? It's not him personally, it would be his counsel. And if I'm lying, call me a liar. But what I'd say is what they told me was they wanted to see language that protected the health and the life of both the infant and the mother. And this bill does that. Further, as far as the life of the mother, that's already covered in Constitution. And so I digress. I just wanted to make that what I believe is a point of correction. Thank you, Mr. Chairman.
Thank you. Any other questions for Dr. Hinkle? Thank you, Dr. Hinkle. I think you're off the hot seat. Now you can proceed and go back and save lives.
Thank you.
Mr. Chairman, I've admitted Larry Muley to testify.
Mr. Vice Chairman, can you hear me?
Yes.
Okay.
We can't see you though.
Well, let's try again. How about now?
Would you state your name and the organization that you represent?
I'm Dr. Larry Miley, and I'm just representing myself, Mr. Vice Chairman. And I would like to thank you all for allowing us to speak to testify via Zoom. I appreciate that. I'm a board certified pediatrician. I'm trained at Children's Hospital in Denver. And I do oppose this bill. And the main reason why I oppose this bill, and I know I'm very much in the minority, I realize that this bill will pass. And it's kind of difficult for the committee members to listen to testimony that they don't believe in. And having been in the legislature for 10 years, I can sympathize with that. I guess the main thing I want to emphasize is the fact that there is a common belief out there that we are having a lot of abortions here in Wyoming, and that babies are not being taken care of well by our physicians in the state. And I would push back against that. What I see happening is that if you don't believe what the bulk of the legislature believes, then your beliefs are unwelcome in the state of Wyoming, and you may yourself be unwelcome, and that bothers me as we're trying to recruit physicians to come to the state. So when beliefs override what I consider to be wise medical decisions, I think we've got some real problems, and I would suggest.
Dr. Miley, would
Yes.
you move a little closer to the microphone? We have a little difficulty hearing you.
Okay. Is this any better?
That's better. Thank you.
Okay. Thank you. What I was finishing up saying was that I think that if doctors don't believe what the bulk of the legislature believes, then they really feel unwelcome here in the state of Wyoming. And when we're trying to recruit doctors to the state of Wyoming, I don't think that is a good situation for them to realize as they come to the state. And when beliefs override what I consider to be good medical decisions, then I think we have some real problems. And so I would push back against this legislation and ask the legislators to vote no, knowing I'm very much in the minority. Thank you.
Thank you, Dr. Miley. Any questions for Dr. Miley, who was, I believe, the health director for the state in the past?
Mr. Vice Chairman, that is true. I at one time I was administrator of the Division of Health and Medical Services, which is now the State Health Department, and at the same time I was also the State Health Officer, which meant that I did both jobs. Now they're they've been separated. I will say that even though I did two jobs, I only got one salary.
Yeah. Thank you, Dr. Miley. I don't see any questions for you. Thank you.
Mr. Chairman, I've admitted Nathan Winters.
Thank you. And would Nathan Winters, former Representative Winters, like to make any comments? We'd be happy to hear them. Thank you.
Thank you, Mr. Chairman, committee. My name is Nathan Winters. I'm the Executive Director of the Family Policy Alliance of Wyoming, and I'm thankful for the opportunity to see you all, at least via screen today, and for the opportunity to speak on this. Let me just say it this way. I know that some feel strongly that this is a mere question of healthcare, but there are many of us who feel very strongly that the taking of a human life can never be reduced to the question of appropriate healthcare. This bill is a very simple, straightforward bill. It simply requires that doctors treat all babies equally, and it would simply require physicians to take the same medical steps that they would take for any other baby born alive. And so Senate File 34 recognizes that abortion is a unique situation, and that it's a situation that some people intend to use to take a life. And that's the reason why it is something that we adamantly oppose. Senate File 34 protects an unwanted life, a life that is completely defenseless, who in the circumstances we're contemplating in this bill doesn't have a single advocate in the room to speak on behalf of that life. And that's the reason why bills like Senate File 34 are so important, because this is the situation where government has to step into the room as a strong but silent protector, guardian, if you will, over that infant when medical professionals and others would rather carry out the disposal of that life. And obviously there are deep questions that we have to contemplate, but this is the role of government. This is not government stepping between a woman and her medical doctor. This is a place where government steps up for the life of an innocent who has no one else to speak on their behalf. And so Senate File 34 is very important. And so I fully recommend it to you and would ask for your favorable vote. With that, Mr. Chairman, if there's any questions, I would be willing to answer. Thank you.
Thank you, Representative Winters. Any questions from members of the audience or the panel? I don't see any, so you're excused. Thank you.
Mr. Chairman, I've admitted Wendy Volk.
Good morning, Mr. Chairman and members of the committee. My name is Wendy Volk. I live here in Cheyenne, and I am speaking in opposition of Senate File 34. As a wife and a mother and a fifth-generation Wyoming businesswoman, I am also Republican. And for 30 years, I've advocated and promoted a common sense approach that I thought Wyoming supported about reproductive health and well-being, based on a respect for each individual's right to make informed, independent decisions about health, sex, and family planning. I support an individual's very personal right to make informed, independent decisions about their reproductive health care options, including abortion. I trust women and their families to make decisions that are best for them and free from governmental interference. If a Wyoming woman cannot make her own reproductive decisions, she cannot control anything in her life. If I were faced with the difficult decision of having to terminate a pregnancy for whatever the circumstances they might be, rape, incest, whatever that is, it's personal. And my question to you is, if a child was born alive after an attempted abortion, who will be responsible for raising that child? Will it be Marty Halverson? Will it be the Farm Bureau? Will it be the Catholic Diocese? These are things that if you do say that doctors are not performing miracles, which they are every day with delivering births, but I'm very concerned that this proposed legislation must not move forward. It is a messy and ugly bill. That's why the governor and his council turned down this bill a year ago. The bill would require doctors to use all means to save a life of a born child alive after an attempted abortion. And it would put our physicians in a terrible situation, and where they would know this could affect their malpractice insurance, this could affect their livelihood. And I'm going to ask you to please vote no. It is unnecessary. Our current Wyoming statutes and medical physicians are taking care of women and their babies, but our current statutes address this issue, and they're quite adequate. Senate File 134, represents political interference in families' decisions. And I'll be happy to take any questions. Thank you for allowing me to speak.
Thank you, Ms. Baltz. Any other questions for the witness? I don't see any. So thank you very much for your testimony.
Thank you.
Mr. Chairman, I've admitted Michael Selmer.
Mr. Chairman.
Thank you. Would you state your name and the organization that you represent?
Yes, Mr. Chairman. My name is Michael Selmer. I am testifying as a private citizen, not representing any organization. And I thank you for the opportunity to testify. I wanted to follow up on what Ms. Volk had said, that if a pregnancy is terminated, as Mrs. Halberstrom had mentioned earlier, at the point that that fetus is no longer within the woman's body, that pregnancy has then been terminated. And the implication was that at that point, it was no longer within that person's control as to what would happen with that terminated fetus. And if that is what is what is being said, then at that point, based on this law, it seems to me that there should be amendment that states that at that point, the state is then responsible for that fetus and will at that point take over all responsibility for its care. That really is what this bill is doing, is making the government the controlling body. I just think that is not a Wyoming virtue. I also have a significant problem with this bill in that if it comes to the point that someone, and I'm not sure which body you would appoint to do this, decides that a doctor has not done everything possible, who is making that judgment, and who is deciding whether to go forward with a prosecution? And have any of you considered the complexities involved with prosecuting under this law? The people on the scene, the doctor who's making, excuse me, making this judgment is the one that most understands all the circumstances. And this bill, in my mind, takes that completely, takes that away and does not provide another body which will then make that judgment instead of the doctor. I think that you're setting the state up for a significant amount of expense down the road when, in the very rare, unusual circumstance when someone is charged under this bill, under this law, it just befuddles me how this bill is advanced this far without someone considering who will prosecute and how, and without recognizing that it will go through appeals and cost the state a significant amount of money. And that's really all I had to say. Thank you for the chance to testify.
Thank you, Mr. Selmer. Any questions from the committee members for Mr. Selmer? Seeing none, I appreciate your comment. Have a good day.
Mr. Chairman, I've admitted Dr. Jovanina Anthony.
Yeah, look. Quiet down.
Dr. Anthony, you will have to unmute yourself.
I'm so sorry. Can you hear me now?
Dr. Anthony?
Can you hear me?
Yes, I can hear you. And we're going to have to limit our testimony because we're almost to the end of the day in our committee and we need to move on to this bill. So I will give you about 2 minutes to talk. Thank you.
Okay. Thank you so much, Chairman Halliman. And my name is Jovanina Anthony. I practice obstetrics and gynecology, and I'm currently sitting in the Marbleton Big Piney Clinic waiting to see patients. So I'll just keep it super brief. I oppose this bill, and the reason I oppose this bill, first of all, is unnecessary. There are no late procedures, abortion procedures performed in this state. This is a problematic bill because of terminology primarily. And if we consider abortion the end of the pregnancy or inducing the end of the pregnancy, regardless of gestational age, the issue becomes problematic when we speak to the needs and wishes of the parents. And this is a bill I reviewed with the governor and multiple representatives last year. And I have problems with it because it hamstrings obstetric providers in scenarios where we're ending a pregnancy for a baby who is potentially quite impaired with anomalies, many of which are not compatible with life. And the parents may request that the baby not be resuscitated because of these anomalies. And since we don't do pregnancy terminations late in pregnancy in this state, I'm concerned that the word abortion in this bill would also refer to induction of labor later in pregnancy for fetuses or babies that we know are not viable, and requiring the pediatric providers to resuscitate these infants against the wishes of the parents is what really, really disturbs me about this bill. And it is not making any exceptions for these scenarios. And I feel that this is a really dangerous path to go down with regards to the complexities of what is happening in the delivery room. And I'm concerned that this is really a bill not addressing the abortion debate, but something that hamstrings us in the moment where we have to make very, very complex decisions with the parents about babies who have a lot of issues. And I feel like it does not address the parents' needs. So thank you very much for the opportunity to testify, and I'll leave it there.
Are there any questions? Chairman Wilson.
Thank you, Mr. Chairman. And I do want to apologize I had a bill in another committee. Dr. Anthony, I have a question there as far as the care. So the bill says the commonly accepted means of care that would be rendered to any other infant born alive. So supposing that you had a patient who for some reason had poor prenatal care, they were traveling or just low income or something, and showed up, in the 8th month. And because of their poor prenatal care, did not realize that the baby had anencephaly. And the baby, I think that's the right, I'm not a clinician, but I think that's, so, and the baby was born. I'm assuming that the pediatrician would not run the baby off to an incubator and stuff the poor little baby full of saline drips and whatnot, because it's plainly not going to live. So I guess my question there is, the case we keep bringing up of a child with basically so many conditions that they're not going to live. Is it really the standard of care for a baby whose parents wanted the baby to actually take, say, a baby with anencephaly with no brain, basically, that's what that is, and haul them off into an incubator and under the thought that somehow you're going to rescue? I mean, is that really what would happen to a wanted, to a baby who was not expected to be like that? Really, is that what the pediatricians would do?
So in the case of anencephaly, most parents would not want that to happen. But this bill states that if the baby is born alive, it must be resuscitated. And many anencephalic infants are born alive. That is problematic. If you're trying to distinguish between wanted and unwanted, that is very tricky, because an anencephalic baby who is born to parents who wanted that baby, that's not technically an abortion procedure, but do you see that these are subtle nuances here? If the baby is born alive and there is statute that states that baby must be resuscitated, there's nothing in this bill to say that there are all these other conditions in which that is not warranted. And I might add, a more common scenario would be in babies born on the threshold of viability who may have a very low chance of survival. And sometimes the parents will choose not to resuscitate because they understand that the morbidity associated with that baby surviving resuscitation is extraordinarily high. And sometimes the parents will make the decision to not resuscitate, even though there may not be 100% chance of death. But it is up to them, in my view, and it is problematic to deny the parents their wishes and proceed with resuscitation that they do not want to happen. And I feel that that is an interference in the process by the state.
Go ahead.
Thank you, Mr. Chairman. So the thing is that the bill does not say that the child must be resuscitated. It says the commonly accepted means of care that would be rendered to any other infant born alive, medically appropriate and reasonable steps to preserve the life and health. So, I mean, I would hypothesize, not as a clinician, but that in whether, and so let's not say wanted or unwanted, because I appreciate the nuance you're trying to make there, but let's say unanticipated problems in the case of a lack of prenatal care versus something that might have been anticipated and maybe there's an early induction or something like that. But so I feel like it seems to me that the interpretation that we're mandating resuscitation is not actually in the wording. We're just saying that, as I'm just picking, you know, a baby with one baby with anencephaly versus another baby with anencephaly. If they were doing an abortion and the baby had anencephaly, you wouldn't do anything to it differently than you would a baby that was where the family had been looking forward to welcoming that baby. So I don't see, I guess, how could you explain to me why you're interpreting the sentence about medically appropriate and reasonable steps and the care that would be rendered to any other infant born alive as mandating resuscitation? If you could explain the interpretation of that.
Well, what I see here is the state telling the physician what is medically appropriate and reasonable. What is medically appropriate and reasonable is not necessarily a cookie cutter type of, procedure. If this bill says any physician performing an abortion shall take medically appropriate and reasonable steps to preserve the life and health of an infant born alive. Medically appropriate and reasonable to whom? I would be concerned that this interpretation it's just not clear. It doesn't say, for example, our last speaker may feel that a baby at 26 weeks, which has high morbidity, but not a 100% chance of dying, that medically inappropriate, reasonable steps are to perform chest compressions and intubate that infant and be aggressive with resuscitation. But if the baby's parents do not want this to occur, is that now not medically appropriate and reasonable? I mean, an anencephalic patient or baby is a much clearer scenario, but I just think this language is too gray. It is too easy to punitively go after a professional who took the requests of the parents seriously at the risk of breaking the law and potentially losing their license and more. So I just think the state has no role in this decision-making process. And if things like this, if bills of this nature are going to be passed by this legislature, I would ask that some sort of ethics committee be available to physicians like myself who don't want to break the law, but do not know if we might break the law by performing what we believe is ethical medical care.
Thank you. I have a question for you. I think that this really leaves it in the world of the physicians to decide what is medically appropriate and reasonable. It's not in the law. I think that is left to the medical profession to decide. Don't you see that as as a likely outcome of this?
It's just a scenario that, the wording of the bill is difficult because, first of all, a late second trimester procedure, which is extremely complex, these aren't performed in this state. So we're trying to interpret as the physician providers, what exactly is an abortion beyond viability? And the only way I can interpret this is that I'm inducing labor for a patient who wants to end the pregnancy, but for whom the baby may have issues for which they have chosen not to pursue resuscitation to maintain its life. And I'd love to think that the physician is allowed to make those decisions, but if that's the case, why are we required to have a bill of this nature?
Thank you. Any further questions for our witness? None? And thank you very much for your opinions, Doctor.
Thank you so much for allowing me the opportunity.
I see we have two representatives that were not present earlier. Do you wish to make comment on this bill? No. Then I guess we're at the point where we can decide whether we want to move the bill.
Mr. Chairman, I just had another person in the Zoom waiting room raise their hand. I don't know if you want to take testimony from one more person.
I think we could give this person 2 minutes, and that is all. Thank you.
Okay, I'll admit Jimmy D. Lees.
How do I do my? Where? Start video. I apologize for my delay. Mr. Chairman, my name is Jimmy D. Lees of Sheridan, Wyoming. I'm here in support of Bill SF 34. I volunteer as chairwoman and lobbyist for the Legislative Action Committee of the Republican Women of Sheridan County. We speak with one voice for the ones who have no voice, and we are not alone. The Wyoming Federation of Republican Women also passed a resolution to protect the born and unborn. I would like to refer to, in 2002, President Bush signed the Born Alive Infants Protection Act into law after it passed the House and Senate by unanimous consent. The legislation had previously passed the House in 2000 with a vote of 380 to 15. The 2002 bill clarified that if an abortion results in the live birth of an infant, the infant is a legal person for all purposes under the laws of the United States and is entitled to all the protection of such laws. Every living person matters. This is a life-saving bill for Wyoming's most vulnerable. The law is already there that these born alive infants after an abortion are legal persons. The law is there. What this bill is going to do is bring Wyoming into compliance with a federal law. And all of the little arguments, they are arguments that could be talked about any individual that is in need of medical care, no matter what their age, if they're a newly born infant or if they're an old person, that commonly, what the law calls for, the commonly given means of care would be legally and appropriate to give. I thank you so much for your time and allowing me to speak. Thank you so much, Mr. Chairman.
Thank you. Are there any questions for Ms. Lees? None. Thank you. And committee, do we have any actions on this bill?
Move the bill. Close public testimony.
We're closing the witness testimony, and it's moved by Representative Flitner and seconded by Representative Stivar. So I guess we have any amendments on this bill?
Mr.
Representative
Chairman,
Clifford.
I have no amendment, but I would just like to speak on this bill and why I am going to oppose it. And I just want to thank all my male colleagues in this room for concern about women and their reproductive rights. And I just want to say, as an Indigenous woman whose people have been here before Wyoming was a statehood, government did step in for my people. And I need everybody to know that under the guise of Christianity, there were sterilization programs on behalf. I have aunties that cannot have children that wanted children because government stepped in, because they thought they were doing right for whatever reason. Okay, so I heard that a lot. Forced sterilization on the women of my tribe. And I just don't think this bill is necessary. And I believe in a higher power. I really do. And I love all my babies. I have 22 grandbabies, one more on the way. I believe in life, but I also believe that there's a higher power, and that's the judgment between that woman and whatever higher power that we all believe in. And so I just wanted to share that with you guys. Thank you, Mr. Chairman.
Thank you, Representative Clifford. Any other comments, or I guess we can move on to amendments of this bill. Does anybody have an amendment they wish to offer? We can go through the bill page by page if you wish. It's just 2 pages. Any amendments on page 1? Any amendments on page 2? None. Is it time to call the question?
Representatives Clifford,
No.
Connolly excuse, Flitner. Aye. Hallinan,
Aye.
Ottman.
Aye.
Martinez,
Aye.
Stivar.
Aye.
Representative Worf, left an aye vote, Mr. Chairman. Representative Wilson, I'm sorry.
Aye.
And Mr. Vice Chairman, aye.
Aye.
We have 7 ayes, 1 no, 1 excused. The excused is Representative Connolly and the no, Representative Clifford.
Thank you.
Okay.
Thank you, committee and audience. I appreciate your testimony.